Hi, my name is Dr. Danielle Crane. I'm a clinical psychologist, and today I'm going to be answering your questions. So the first question I've had is, can a psychologist ever have a romantic relationship with a client? And the answer is very strictly no. We have clear rules in place and professional boundaries that we have to maintain, and it would be considered completely inappropriate to have any form of personal or romantic relationship with a client. It would be considered as us taking advantage of someone who's in a very vulnerable position. And if that were to happen, chances are the psychologist would lose their job and potentially not be able to practice as a psychologist anymore. It is something that's taken very seriously. That being said, it is common for clients to develop feelings for their psychologist because that person is often the first person who's ever listened to them properly or shown them compassion. It's someone that they are seeing on an individual basis regularly and talking about very intimate things. So it's very easy for them to develop feelings, and sometimes you can discuss that in therapy to make those boundaries clear, whilst also kind of normalising the fact that the person has developed those feelings, so they don't feel shame around it. I don't know about other psychologists. Personally, I've never developed feelings for a client. And hopefully that's not taken as an insult to any of my clients. It's just that when I'm in therapy, I am in a completely different mindset. I am there as a professional. I know the clear boundaries that are in place, and I am focused on the client's needs, the client's emotions, their difficulties, and how to support them with that, rather than focusing on my own feelings or thinking about them in any kind of romantic sense. My next question is, have you ever fallen asleep during therapy? And I'm very glad to say the answer is no. I would feel absolutely horrendous if that ever happened in any of my therapy sessions. At the same time, I have heard of it happening to other therapists, and I feel really bad for the clients in those situations because chances are they were talking about something really personal or traumatic, and it must be completely invalidating to find that your therapist is then asleep. That being said, there are many reasons why it can happen. Firstly, we are human, we make mistakes, we also get ill. Sometimes we've been up all night with our sick kids and we're sleep deprived. There's also things like countertransference that happen in sessions. Sometimes if you're working with a client who is really severely depressed, you can end up feeling some of that in your session, so feeling completely drained of energy, or that's the same way that your client is, you pick up on some of their emotions, and that can sometimes make people feel quite tired, or if someone is very dissociated, sometimes that can make therapists a bit sleepy. So there are lots of reasons why it can happen. At the same time, I think it's really important that psychologists do everything they can to try and prevent it. So if it's countertransference, that they discuss it in supervision. If it's that they're ill or sleep deprived, that they consider whether actually that session should go ahead, or whether it needs to be rebooked for a point in time where they're able to give the client their full attention and conduct that session in a way that's going to be helpful. My next question is, can adults be diagnosed with autism? And the answer is yes. So you can be diagnosed with autism at any age, really. A lot of people can have it in childhood and it gets missed. So it might be that because they are reasonably intelligent or because they're good at masking their difficulties, that it doesn't get picked up by teachers or professionals until later on in life. If you think that you have autism, you can go to your GP and ask to be referred for an assessment. So there are, in many areas, and I'm talking about England when I'm discussing this because that's where I'm based. I'm afraid I can't comment on how things are done in America or other countries. But in England, we do sometimes have autism and ADHD services that provide those assessments. If you are already under the care of a mental health team, then sometimes they can do those assessments themselves if it is something that will directly inform your mental health care. If there are long wait lists in your area, then you can use something called the right to choose pathway where you can request referral to a different provider that has a shorter wait time, and the NHS will usually fund that. I will put a link in the description for this video for how to find out more information about that. So yeah, I hope that's been helpful. You can be diagnosed at any age. My final question is, can animals have mental health problems? Which is kind of out of my area of expertise. So I actually grew up in a veterinary practice and worked there for many years. So I have a lot of experience with animals. I also have a lot of experience working in mental health, but generally not the two together. The impression I get is that animals can definitely have depression and anxiety, but I would be very cautious about saying that animals have other mental health conditions, just because it's very hard for us to determine. So, for example, with OCD, with an animal you could observe potentially compulsive behaviours, but you wouldn't be able to assess for the obsessive thoughts. I've heard people say that their dog has psychosis. I imagine it's very hard to tell if an animal is hearing voices. I think you probably could tell if they were hallucinating or seeing things that weren't there, based on kind of watching their eye movements and their reactions. But it is so difficult to assess animals for mental health problems in the way that we do with humans. My other reservation is that if someone were to assume that their animal had a mental health problem, they might miss actually an underlying physical health condition. Animals often act in really unusual ways if they are experiencing physical pain. So if you do think that your animal has a mental health problem, I recommend going to a vet, having a full kind of physical health check to rule out any pain or other conditions, and then potentially talking with a trainer or behaviourist to check if there are any kind of behavioural reasons why they're responding in that way. So I'm not saying animals can't have mental health problems, I'm just saying it's a difficult thing to assess, and please do rule out other causes for that behaviour. So yeah, I hope that's helped. As I said, not my area of expertise. Please feel free to go and research it for yourself in more detail. And yeah, feel free to comment below if you find anything interesting. Thank you.